Are you really seeing young people? Because we keep saying that if and when you're young, that's the time you should buy a health cover, and not when you're already in your 50s or 40s. Are you seeing a shift that younger people today are becoming more conscious of the fact that I need to have a cover? Because we've talked at length, even over the many years, that how low the health insurance penetration is. Of course, it's picked up, as Antony said, but are you seeing a shift in the way young people are perceiving health now?
Right. So I think there are a couple of trends that we are seeing with the youth. The first one is young people are getting more aware about the need to take care of their health. So clearly, if you see all the leading indicators of gym membership, of people wanting to participate in runs and marathons, you do tend to see that number going up quite significantly. And a lot of that numbers are actually below the age of 30, which I think is an important leading indicator, because first you need to start taking care of your health. That's not really translating into the kind of penetration that we need to see in health insurance. A lot of that has to do with lack of awareness. A lot of that also has to do with the idea that the youth have about invincibility.
I was just going to come to that, if that has changed.
Which I think human beings have, in general, but the youth is a little more, a little more invincible in their minds than the others. Some of that is starting to change, and that's where the entire digital platform, the ability to make the product really, really simple, and then the ability to really highlight the 2 or 3 things that really stick in their minds as to why they should be purchasing health insurance. But it's still very, very early days for us in terms of truly bringing the youth into purchasing health insurance. So I'll say that the leading indicators are good. People are tending to participate and get more and more health conscious, but that's not yet translated itself into purchase of health insurance yet.
This invincibility thing that Subrat talked about, is that a change you are seeing? Are you seeing more people who are younger coming and actually taking policies?
Certainly, if I look at our book, and our book is about 9 full years old now, and we have a majority of the people who are in our book on the retail side is in around the 30, 35 or 40. Between 30 and 40 is what I would say. But what I would like to add here is, this young population is becoming more aware of the need, not just because of what they see in terms of healthcare costs or these inflation and various other things which are happening, but just think about this group of people. India is a young population. I think average age is what in the 30s, right? If you look at their family, they have parents who are in the 50s and 60s. They have grandparents who are in the 70s and 80s. Now, what is also happening to this young generation, which is raising awareness in a different ways, they are seeing issues related to their parents and grandparents, and then they can relate it to healthcare costs. So it's not a nice thing for anybody to get hurt with, but it is certainly bringing about awareness, because family members are also getting
sometimes the fear sets you thinking, right? We've seen a spate of cases right now in the very recent past where people have come out to say that I just had a dengue and I've been the double-digit kind of thing, and the fact is healthcare costs are going up, and it's time you realize that healthcare, if you want good healthcare, it's going to cost you.